Hi, everyone. Hope you're all doing well. Welcome to the seventh annual, but first virtual school wellness summit. Thank you to the planning committee members and Kirsten Criswell for the invite. I have had the pleasure of speaking with you as well as presenting at previous school wellness summits and am honored again this year. My name is Katherine Hawksworth and I am with the Center for Wellness and Nutrition, a program of the Public Health Institute. So this is what I'm going to briefly talk to you about during the School Wellness Summit. I will share a little bit about who we are and what we do, as well as the whole school, whole community, whole child framework or model. And certainly the services that we at the Center for Wellness and Nutrition provide in order to support a healthy school environment, as well as a thank you and my contact information. So the Center for Wellness and Nutrition is a program of the Public Health Institute, and we are California-based, but provide support to local, state, and national partners and projects. We work to promote wellness and equitable practices through our vision, which is a healthy nation where wellness is achievable for all. And we do that with our mission to build capacity and leadership within institutions and organizations in order to make that happen. Our four grounding goals really are rooted in advocacy, education, research and evaluation, and training. And these are framed with a few of our values, and to highlight a couple, such as equity, partnership, innovation, community. Much of our work centers on nutrition, food access, nutrition education and promotion, food justice, as well as community, parent, and youth engagement, including physical activity, PE, and other elements of school and community wellness. Pre-COVID, we did host in-person meetings, convenings, and trainings, just like many of you. And we too have had to adapt during COVID and have moved our work virtually. So this here is the whole school, whole community, whole child model. And I want to make sure that, some of you may know what this is, but I will provide a brief overview of what it is for those of you who may not yet know. I want to make sure that I do give credit where credit is due, and that the information I'll be sharing actually was swiped, if I can say that, from one of Mike Danzig's trainings that he did for us recently. Mike Danzig, if you're not familiar with who he is with the California Department of Education Nutrition Services and has presented at previous school wellness summits, I believe including this one too. I just like the way he does a great job in framing the WISC model and linking it actually back to the local school wellness policy. So thank you, Mike, for your inspiration and your words. So the WISC model or framework places the child at the center. It takes a comprehensive approach to supporting learning and health, calls for a greater collaboration across sectors, and aligns with the USDA's local school wellness policy requirements. The WISC model was created by the ASCD, formerly the Association for Supervision and Curriculum Development, and the Centers for Disease Control and Promotion, the CDC. It is the evolution of the coordinated school health model and is currently the CDC's current framework for addressing health in schools. The tenets of the WISC model align perfectly with the local school wellness policy requirements. You'll see that the community is on the outside embracing the inner circles. And the circle inside the community is where you find the 10 components of health and wellness. It is these components, if all were implemented, that create healthy school community that we all are working to strive for. They also represent the key school-related stakeholders that, along with your community members, sort of like round out your wellness committee. Hopefully many of you are participating and are listening in and are actually involved with your wellness committees. So your students, your school board members, your teachers, your superintendents, your nurses, paraprofessionals, all of you folks, that these are the key players, meaning you are the key players that know your district's needs, your school's needs, and your students' needs. The WISC model, as we said, places the child at the center, again, as does the wellness policy, both with the goal of ensuring your students are healthy, safe, and supported. COVID has now forced us to shift our work to meet a very different environment, no longer within the confines of a physical school campus. So we need to develop and implement plans that will cross from campus to home and many places in between. This will depend more than ever on forming partnerships between the community and the school, something both the wellness policy and the WISC model rely on for success. Again, thank you, Mike, for providing the image and for crafting these important talking points. So now on to support that we offer to help you create healthier school environments virtually. So we at the Center for Wellness and Nutrition have the expertise in community engagement, particularly through a health equity lens. We are currently one of the few technical assistance providers for the CDC, supporting the number of their grantees as they work on community engagement initiatives. We have developed a toolkit that helps guide the process of engaging community members. So why engage community? Well, we know that it increases the likelihood that solutions will be accepted. It gains community input, buy-in, and very importantly, power. It creates more effective solutions, and that draws on the local knowledge and experience. So as I mentioned, we did create a toolkit that is available, and that in this toolkit, we highlight the 4-step advocacy process in our that really addresses these key steps. 1, recruiting and retraining folks. 2, identifying problems and solutions. 3, action planning. And 4, evaluation and documenting success. Not only do we offer trainings and technical assistance regarding community engagement, but we have experience in engaging youth and supporting youth-led participatory action research. We train organizations to work with youth on YPAR and photo voice projects, as well as other engagement strategies. We build genuine partnerships with young people as change agents who have an important voice in creating healthy community and school change. We believe that both youth voice and buy-in are imperative to building sustainable, healthy schools and communities. So some of you might be asking, well, what the heck is photo voice? Well, let me briefly explain what it is. So voter voice is a type of participatory action research in which people use photographs and or video to picture their environment and experiences and to express their thoughts about them. And usually this is accompanied by the following few goals: that it's really grassroots assessment through art and social action, to record and reflect community strengths and concerns, to promote critical dialogue and knowledge about important issues, and to reach and influence policymakers. So we have documented YPAR and youth engagement success stories going as far back as 2006, and that these 3 documents highlighted here provide the experiences, examples, and recommendations from the voices of youth and adult allies that we've worked with. You can certainly find this information on our website located there. Similar to youth engagement, we also have experience and expertise and resources that support schools and districts at engaging parents and caregivers. And as you recall, one of the components of the WISC model is to engage family and communities. So there, as we know, numerous benefits to parent involvement in schools. It can promote positive health behaviors among children and adolescents. We know that research shows a strong relationship between parent engagement and educational outcomes, and schools with involved parents become better schools. We also know that students with involved parents, no matter what their income or background, are more likely to attend school and have higher grades and test scores. Similar to our community and youth engagement approach, we utilize a 4-step advocacy process. So looking at recruiting and retaining folks, identifying problems and solutions, action planning, and of course, evaluation and celebrating success. In the past, we have worked in partnership with parents who, through our trainings, felt confident and empowered to create healthier school environments. Previous examples have included that they actively participate and are engaged in the school wellness committee. They participate in revamping or updating and strengthening the local school wellness policy. These parent leaders have also helped submit successful grant requests, and that they advocate for healthier school meals, including reducing and or eliminating sugary beverages such as flavored milk, and looking at ways to increase access to water. So not sure if your district's wellness committee is currently meeting, but maybe a good idea now that the new school year has started. I'm sure parents and caregivers may have good ideas to bring forth. School and district leadership engagement is work we've also always have done. With support actually from the Valley Children, we have been currently virtually engaging districts across 2 California counties regarding their wellness work. Some of you may have rolled your eyes about your wellness committee groups now meeting, but I do want to share with you that a district that participates in our virtual convenings has not only reconvened or brought together or brought back their wellness committee, they made sure that youth voice was represented, and they actually updated their local school wellness policy and conducted their triennial assessment, all during COVID. So wellness work is still possible. There may be even a few districts currently listening in that we've supported over the years, including helping to develop your local school wellness policy action plan and or conducted or facilitated professional development trainings for your teachers and staff. Note, many districts listening in may have submitted their triennial assessment waiver. We at the Center for Wellness and Nutrition continue to work closely and partner closely with the CDE and other statewide partners, and are currently working together on resources that may be useful in the coming months, so please stay tuned. I share the work we do as a way for you to think about what you may consider to be your next steps in creating a healthy school environment. We all need to continue to be innovative in partnership with our communities, our students, and our families, and we cannot do this work alone. Times are certainly different, and the way we work must be done differently. And it's even more imperative that we seek out the creativity and ideas that come from outside ourselves. We're all adapting, reimagining, and establishing new norms. We at the Center for Wellness and Nutrition have been modifying our practices and have so far been quite successful in developing interactive, engaging trainings and webinars that address the topics I covered. If you are inspired by what we can offer, we certainly encourage you to reach out to us, as we may be able to help support your work. This here is my contact information. I certainly encourage you to reach out. Again, my name is Katherine Hawksworth, and I'm thankful for this opportunity and appreciate the committee and Kirsten for the invite. Please consider following us. Much love to you all, and please be safe.